For a long time, depression has been diagnosed in the same way, by looking at a person's symptoms. If someone feels sad, tired, unable to enjoy life, struggles with sleep or appetite, and has trouble thinking clearly, they may be diagnosed with major depressive disorder. These symptoms are described in a guidebook called the DSM, the Diagnostic and Statistical Manual of Mental Disorders. It's the most important manual used by psychiatrists and therapists to diagnose mental health conditions. But here's the problem. The DSM focuses entirely on symptoms. It doesn't explain what causes them, and it treats all depression as if it's the same. A major new paper, published in JAMA Psychiatry, challenges that idea. The authors argue that it's time for a new approach. They propose that the next version of the DSM-6, should include a new category within depression, something called depression with inflammation. Why? Because growing research shows that, in many people, depression isn't just about mood. It may also be about the immune system. Studies show that about 1 in 4 people with depression have high levels of inflammation in their body. That means their immune system is activated, even though there's no infection or injury. Doctors can see this through blood markers like C-reactive protein, interleukin-6, and tumor necrosis factor. These inflammatory chemicals don't just affect the body, they reach the brain. And when they do, they can disrupt brain function. They affect dopamine, which makes it harder to feel pleasure or motivation. They slow down thinking and movement. And they change how the brain responds to rewards and stress. This type of depression looks different. People often feel empty or numb, more than sad. They feel tired, disconnected, and unable to enjoy anything. They move slowly, have trouble concentrating, and may even look flat or withdrawn. It's not just psychological. Their body and brain are reacting to signals of stress, almost as if they're still fighting off something, even when the real danger is long gone. This is why the authors believe the DSM needs to evolve. They suggest adding an inflammation specifier to the diagnosis of major depressive disorder. That means someone would still be diagnosed with depression, but doctors would also note that the depression is linked to inflammation. This isn't about changing the entire diagnosis. It's about adding a layer of understanding. Just like cancer doctors now treat different tumor types in different ways, mental health professionals could start tailoring treatment based on what's actually happening inside the body. The benefits of this approach could be huge. For one, people with inflammation-related depression often don't respond well to standard antidepressants, but they may benefit from other treatments, like medications that reduce inflammation, or therapies that target motivation and reward systems in the brain. And identifying inflammation early could help avoid years of trial and error treatment. Blood tests for inflammation already exist. They're simple, affordable, and widely used in general medicine. Including them in mental health assessments could help pinpoint which patients are most likely to benefit from alternative treatments. This proposal is part of a growing movement toward what's called precision psychiatry. Instead of giving the same treatment to everyone, it means looking at biology, psychology, and life history to create a more personalized plan. It's not just about fixing symptoms. It's about understanding where those symptoms come from and what kind of help will actually work. For now, inflammation is one of the clearest biological pathways we know about in depression. It's not the only one. But for the people affected, this recognition could mean getting the right treatment sooner. If the DSM-6 includes an inflammation specifier for depression, it could mark the beginning of a major shift. A shift away from one-size-fits-all psychiatry and toward a more personalized, effective, and compassionate approach to mental health.